Last week, Emily's clinic started using Optum Care Suite, which analyzed Emily's data and recognizes she is being poorly managed. Because Emily was in the ER again last night, the nurse contacts Emily's mom to schedule an appointment with the doctor. When they arrive, the receptionist sees Emily needs to have an updated asthma control test, which is completed electronically. The asthma control test is a scientifically validated standardized questionnaire. Through a series of questions, the ACT evaluates a patient's control of their asthma and can help guide treatment decisions. Once completed, the test results are also automatically uploaded to Emily's medical record by Optum Care Suite. The doctor prescribes a new inhaler for Emily using his EMR. This information automatically synchronizes with Optum Care Suite. The nurse returns to build a personalized asthma care plan. The care plan is the forward-looking set of events that will be tracked for Emily's care. Optum Care Suite enables the care plan to be customized in real time with the patient. The care team can make the plan available to all other healthcare professionals directly from Optum Care Suite. By understanding future events, we can better determine future costs and how to manage them. Now, instead of spending the night in the ER, Emily can enjoy a slumber party with her friends.
Voices, some small and quiet, sometimes distant and undetected, often loud and all at once. In even the best conditions, following the conversation can be difficult, especially when your hearing isn't what it used to be. Declining hearing ability is one of the most common physical conditions as we grow older. Fortunately, there is a path to better hearing, and the first step begins right here with the guidance of qualified hearing care professionals. They will use their expertise not only to identify the sounds you can and cannot hear, but also to build up a full understanding of how you wish your life to sound. If you would benefit from a hearing solution, they have the expertise to recommend the solution best suited to you. Today's hearing instruments are technological marvels, both discreet and comfortable. Some sit inside the ear, while others sit behind it.
Pain can have intense adverse effects, both physically and emotionally. Living with chronic pain is difficult and can keep you from doing what you enjoy. Our goal is simple. We want to help you control your pain without side effects. Our devices help millions of people reduce pain and make a speedy recovery. With the help of MP devices, people who are unable to accomplish daily living tasks are now able to control their pain and take back their lives.
Heart failure is a progressive disease that can make you feel weak, tired, or breathless, and may cause a buildup of fluid in your lungs, often called congestion. If you're diagnosed with heart failure, your doctor may monitor your weight and blood pressure or prescribe several different medications and even recommend a cardiac resynchronization therapy device, or CRT. Now, there's a new tool. This little sensor, no bigger than the size of a dime, will be implanted in your pulmonary artery during a minimally invasive procedure called a right heart catheterization. Once the sensor is implanted, you will be able to take readings of your pulmonary artery pressures at home. Taking and sending your readings will take only a few minutes. The pressure readings are immediately sent to a secure website accessed by your physician. With the information obtained from the CardioMEMS HF system, your doctor will be able to adjust your medications, thereby reducing your chances of ending up in the hospital. Thanks to advanced medical technology, people with heart failure are living better, healthier, more active lives than ever before.
Es un sensor diminuto, del tamaño de una moneda pequeña, que se implantará en su arteria pulmonar durante un proceso mínimamente invasivo que se llama cateterización del lado derecho del corazón. Una vez que se le haya implantado el sensor, podrá tomar lecturas de la presión de su arteria pulmonar mediante una unidad situada en el hogar. La toma y envío de las lecturas solo requerirá unos pocos minutos. Las lecturas de presión se envían de inmediato a un sitio web seguro al que su médico tiene acceso. ¿Por qué es tan importante el sistema CardioMEMS HF? porque los estudios clínicos revelaron que los cambios de presión de la arteria pulmonar son un buen indicador del agravamiento de la insuficiencia cardíaca. Su médico podrá ajustar su terapia de medicación y, por lo tanto, reducir el riesgo de que termine en el hospital. Gracias a la tecnología médica avanzada, las personas con insuficiencia cardíaca disfrutan de vidas mejores, más sanas y activas que nunca.
Several million patients suffer from chronic severe heart disease. Some have had heart attacks, and others experience regular chest pain and difficulty breathing. You may be someone who has undergone surgery, stenting, or is on maximum medications. If your cardiologist has exhausted all options currently available, there is hope. In 2001, research emerged indicating that stem cells injected into damaged hearts could produce significant benefits for patients. There have now been over 60 cardiac cell therapy clinical trials completed since that promising beginning, both internationally and in the United States. Today, Okeanos cardiac stem cell therapy is available to patients outside of clinical trials. This treatment option makes use of your body's own natural biology by restoring blood flow to your heart and helping it begin the process of healing itself. Cardiac care has evolved to bring new medications, devices, and procedures to heart patients, each primarily aimed at slowing the progression of heart disease and reducing symptoms by restoring blood flow to the heart or handling the symptoms related to lack of blood flow.